So today we are going to talk about Angelman syndrome. This is a rare genetic disorder. It is caused by the absence of certain genes present on chromosome 15 that is inherited from the mother. So if you remember from what we've talked about in class, each chromosome has two copies, one from the mother and one from the father. So this disorder affects the chromosome from the mother. It primarily affects the nervous system in patients. They usually have general brain development, delayed brain development. Sometimes they can have different facial features and facial deformities, and it often affects their muscle and nervous system, so they have a hard time moving around and being mobile. Some of the characteristic features are delayed development. They will hit milestones much later than children around the same age as them. There may be some sort of intellectual disability. They usually have severe speech impairment. They have problems with movement and balance. So as a child, it may just seem that they're very uncoordinated, and they usually have a happy demeanor. In severe cases, they can have epilepsy and recurrent seizures, and sometimes they can even have a smaller head size. There are a couple different causes of Angelman syndrome. However, all of them affect the UBE3A gene that is found on chromosome 15 from the mother. So no matter which one of these 5 categories it may fall into, it is all affecting the same gene on the same chromosome. In most cases, the disease is not inherited. Usually there is some sort of issue with the UBE3A gene during embryonic development. It can be inherited, hypothetically. However, there are no documented cases of it being inherited. There are multiple treatments and therapies available. You are basically treating the symptoms that each individual patient is expressing. So not every patient goes through all or any of these treatments listed here. Their care is based off of their individual needs. Genetic tests are used to reveal the chromosome defects related to Angelman syndrome. So there are 2 listed here. The first one only tests for 3 of the 4 known genetic mechanisms. So if that comes back negative, they may choose to go on to the second one, the FISH test, to be absolutely positive. Approximately 1 in every 11,000 children are diagnosed with the disease. They are usually diagnosed between ages 6 and 13. Since this is not a very common disease, it's usually one of the last ones that doctors think about. People with this disease do need some medical assistance. Depending on their mobility, they may need help with walking. Some of them with severe speech delays and impediments need devices to help communicate. However, again, this is all based off of individual needs of the patient. There are no specific fertility or reproductive problems associated with the gene on chromosome 15. However, their cognitive effects generally limit them leading the quote-unquote normal life and reproducing to have children on their own. One of the current research studies for Angelman syndrome is looking to see if they can turn on the paternal copy of the UBE3A gene, since it is only the maternal copy that seems to be the issue with Angelman syndrome. They're hoping that if they can find a way to turn that copy on, that will take over the normal functions of the gene and replace the maternal gene. So in conclusion, Angelman syndrome is a rare genetic disease caused by a mutation or defect in the UBE3A gene on chromosome 15.